Welcome to the final installment of our three-part series with Dr. Tommaso Falcone. Let's wrap things up with another great conversation.
So, Dr. Falcone, you were the senior author on the first publication in the world on gynecological robotic surgery, and part of the team that performed the first uterus transplant in the US. Now, I don't know if you know, but recently we've had the first baby born from a woman who received a uterine transplant here in the UK. So, I'd love to hear more about, your work on these groundbreaking achievements and their impact on reproductive medicine, which is only going to change the future, really, of women's health and reproductive health.
The first gynecological robotic surgery I did here, seeing clinics, it was by fortuitous, like as in most things, and like you need a lot of luck to. So the company, which is actually not in existence anymore, called Computer Motion, in the year 2000, something like that, they said we have this amazing technology, and we have a prototype. And so they came to Think Life because of our heart surgeons. And they wanted to take maximally invasive surgery, which is opening your chest, and then trying to do a coronary bypass. So they said, we can do it robotically. But at the same time, they said, maybe we should start with more simpler things where like the risk is not as high. So I was doing tubal surgery. I still do tubal surgery, but the tubal surgery involves anastomosis of a fallopian tube. Someone who's had a previous tubal ligation. So they came here and they said, oh, let's go see the guy down the hall over here. And, he uses, fine suturing, the whole thing. So they came to me and they said, can you do this? We would do the FDA trial. We have to apply the IRB. And so I said, yeah, I mean, it's just a suturing thing. So I was lucky that I was here. And so they brought this technology to us. And in fact, tubal reversal is a very small part of what you do robotics nowadays. But that was the first, clinical trial that was published on gynecological laparoscopic surgery. In fact, the first years, people first of all thought I was crazy, like doing it. And then all the articles in the year of like 1990, 2000 was me, myself, and all people around me, because no one else was interested in doing this, because at that time people would just make a decision. Anyway, and then it evolved, and the technology got far more sophisticated. And the reason why I think it's going to be even increasing, because the technology increased rapidly for about 4 or 5 years and then plateaued. Ostensibly what you're doing now, 2025, was not far from what we were doing in 2005. The robot's big and bulky and all. But now the technology has rapidly evolved. There are many robotic companies, and therefore I think that's the reason why. So the uterus transplant program, and I sent congratulations to Richard Smith, who was the gynecologist. And I know him. It's a small community in the world. He's been working on this for a long time. He deserves a lot of credit. He's an oncologist, and he had bad luck. Like I have good luck. He had bad luck. So I had good luck because we had the group from Sweden that one of our transplant surgeons was part of the Swedish group. So he came back and said, we want to do this, which I thought he was crazy at first. But, then I went to Sweden, I learned from the group, and I talked to patients, and they convinced me, the patient convinced me this is something we have to do. So we came back here, and we did it. So we went ahead and started doing this. Now, Richard was doing research in London for a long time and very good. And his first case was going to be in January or February of 2020. What happened in 2020? COVID hit and basically put everything on hold for years. And it was so unfortunate because it was supposed to be then in 2020. And then COVID hit, everything was on hold. And then, when something stops, it's like a steam engine, to get it started again. So he started it, and then finally they released it and they started it. And this was, I remember when they did 4, as you know. and and this one here who wanted to deliver the baby. And when I heard about this, I congratulated him. So around the world, there were two groups. The ones pre-COVID. I think in the future, everything will be, what we did pre-COVID and what we do post-COVID. And pre-COVID was a big group that was moving rapidly. Everything, came to a halt, and then we started again. So yes, so again, a lot of it has to do in innovation. You have to be open-minded. Like, why would you do something robotically or not in those days? Now it's like self-evident. The old thing. At first, everybody says this is as stupid as you can get. Why are you doing it? And then he says, this looks interesting. And then the third phase is, why did we? Who's doing it the old way? And so, except for the ones who were involved, is involved. Anyways, for robotics and the uterus transplant, same. Although uterus transplant is far more complex than robotic surgery, because robotic surgery is just the technology. It's uterus transplant is actually a not only technological thing, but more importantly, it's a conceptual innovation. And I happen to be around people that help us. And working for the Cleveland Clinic, they've always encouraged innovation. And innovation is, if you're there, open-minded, even if you're not the most innovative or brilliant in the world, the group is always what brings you forward.
And in that vein, what kind of advancements with robotic surgery do you see, shaping the future of minimally invasive procedures in reproductive health?
So in reproductive health, there's no question that these robots, they basically will, dominate the interventional approach, but they're not. What's important is that the cost has come down, and the cost will come down because now there's competition. For a long time, there was no competition with one robot, and in a free market, competition is what makes people, and then costs come down. I was in Mexico City last week, and because we have Cleveland Clinic affiliation in Mexico, and the person said, "Oh yeah, we have a dozen robots, throughout their private hospital system, a dozen robots, and so just to tell you that there, in Europe, we have it here beforehand. Now, like in London, come on, we just ordered our second robot for Cleveland Clinic London, so the cost will come down, and the technology get better." Just like your computer, like your laptop. People even have a laptop. They usually use this, the laptop. What people forget that what's in my phone, it has more technology than what landed people on the moon in 1969, as everybody knows. So the only thing that's important is the cost will come down and the technology will advance, and that means that it will be universally far better. There's going to be artificial intelligence in the robot, like it will feed back to the surgeon. This is not the way to go. Doesn't appear to be the same as the preoperative imaging. So that is very exciting, and it's going to occur within the next decade. Miniaturization, decreased cost, and artificial intelligence telling the surgeon what is that. So this will make it safer, quicker, etc. So therefore, I'm very, very encouraged of how this, actually applies to uterus transplant too. The first patients, the procurement of an organ, could be a deceased donor, which is what we did here, or it could be in a living donor. Oftentimes, the mother would give the uterus to the daughter or sister. So, it used to be a big incision, but now they can take it out robotic. The other day I was here, the procurement was always done for kidney transplant, for example, laparoscopically, or even robotic, or laparoscopically. But the actual transplant is being done robotically now. So instead of making a big incision, you put the kidney in the belly, and then they do, and it's like, so you look at it and you say, oh, it's so simple, or like, why weren't we doing it? Why is everybody else doing it the other way? And it's always that way. But so I'm very confident that this innovation will occur, miniaturization, decreased cost, and the reason is firmly because now we have a competitive environment where the Chinese have their own robot, Medtronics. There's a group around Cambridge. They have a robot there that they make, which is very good as well. And then Intuitive, which is in the United States. So I'm very confident this is going to be really rapidly different.
Yes, it's extremely exciting, but in a way, it's also a bit frightening because perhaps one day the robots might take over.
Yeah. The robot, you know, we're always going, we're always going to need the robots or AI, like AI is going to
Yeah,
remove. So we're starting to use AI in our electronic medical record. If you, I don't know where you work there, but I know Great Ormond Street has Epic, and
yeah,
Liberation has Epic. All right, so we use there are two AI formats, very rudimentary, that we're starting to use here. The first, the AI program, when you put all the data in, it will tell us if the patient is potentially septic, because sepsis is a big cause of mortality, as you know, and you have to move very quickly. So the artificial intelligence built in there comes up and says, this patient is at risk for sepsis. And I said, gee, I did notice that. And then it'll tell you why. It took all sorts of information from different areas. And the
yeah,
second thing, which is more practical. So when you take a history of a patient, when I'm talking to a patient, um, you talk to the patient, you say, what do you hear, the whole thing. And then you may throw in, things like the mother will say, we have tough time coming here and all that. So this interaction. Well, there's an AI program now where you take your phone, it, right? You
yeah,
just
I know it.
you push this little button and you talk any way you want, and you can talk about the weather and I'm going on vacation, the whole thing. And then you push a button and it generates an entire history of pregnant illness, which excludes all the extraneous stuff that you talked about. And that is just the most rudimentary. Then the next phase for us is it'll give you the differential diagnosis and will recommend what your treatment could be. But it still takes me to talk to the patients. And,
Yeah,
it's not the type, where you walk in the room and then, the MRI takes your picture and then, like some AI tells you you have arthritis or something. So I think it's going to be an important part of us. But will it eliminate, like we have scribes, here, when you go into the room, the scribe types all the information because of it, they didn't want to. Well, those jobs may be gone. That is true. So those types of jobs could be gone, like other types we can go into. But it's not going to eliminate the very important role of the clinician in the interaction with the patient.
you're telling me exactly what I want to hear, which is great. So, as someone with more than 500 original manuscripts, abstracts, and book chapters, which of those contributions do you believe have or has had the most profound impact on obstetrics, gynecology, and reproductive health?
Well, it's very hard because something that has an impact in one particular time, is seen as, okay, like in the future, so like robotics at that time, it was very potent because the only one field. But nowadays, there are far more. And Centi goes to transplant. We were the first in the United States to do one, so it was quoted everywhere. But then as time goes on, I said, it had an impact. I mean, the real pioneer was actually the gynecologist from Sweden, because he's the one that did the first in the world that was successful. Um, and so there are a few things that I find that they seem to be um, out there, or at least people quote it a lot. One of them is the economic impact of endometriosis on uh, 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 women's lives. And that one there was published in a journal called Human Reproduction. And it really, really what is important to understand that, we are, and we did this, the study was done in the United States was one site, somewhere in Europe was the other, and if I'm not mistaken, it was Australia. But anyway, it's a tremendous economic impact, and that one is quoted a lot. There are some articles which are quoted, because we were the original ones. I'm looking at cytokine markers of inflammation, where the people were looking at endometriosis, and people. So I mean, it's a lot of these articles. Well, although there's science in it, it's the awareness of the concept that is the one that is the most impactful. So other people will do, cost analysis, but that original one wrote, gave the awareness that this is important, or the robotic one, it gave the awareness that this technology is moving forward. That wasn't the only one, by the way. It was just like there. And essentially was your transplant. We're criticized all the time. There's a weekly article about how this is nuts. Like it's a lot of money, it's risky, the whole thing. And so you just keep with the article. So the article's theme oftentimes is the awareness that it is a pro-inflammatory disease, which of course everybody agrees with now, but at the time, or awareness that transplants is something that patients do want, or that robotic surgery, etc.
So that brings me to my final question, which is something we ask all of our guests. And that is, if a magic genie could grant you 3 wishes for your area of healthcare, what would you wish for?
So first of all, we should differentiate a wish from a miracle. I just want to make that clear. Like I'm not, so miracle would be, cancer would be cured. That's a miracle.
Yeah.
Okay. So I just want to make sure that we're not going in the area of the miracle work. Like no more poverty, no more cancer, no more blah, blah. That's a miracle. So a wish would be, for me, is access to care. Like the world access to care, having been in these different countries, is a critical part of what I think, we need to do. And I would like every patient, women in particular, because I'm kind of conscious, to say, I need access to this, and I can have what I want. Maternal health, contraception, reproductive health. You get the idea. The second thing that is important to me is a wish is because I see a lot of I'm going to use the word charlatans loosely, that offer different treatments for desperate people. And in fertility and reproductive losses, we see, people that are really desperate. And then, there are always people that are trying to use that confidence. I'm going to sell you this, or, hyperbaric chamber, plasma exchange. I just can't believe it every week, that comes up. So I would wish for a clear understanding that we can give to patients. This doesn't work. This works. So I think that, like that would be something that I would definitely feel that is important. And
a lie detector test for your
the lie detector test. Like and perhaps I live this every day because people approach me. The latest thing is longevity. Longevity clinics. Do you hear about this? Longevity clinics is that they want people usually in their middle age. They realize that I've been drinking and smoking and living the long life, but now that I have all the money, I want to live long. And so they're looking for the quick fix, hyperbaric chamber. While what it is eat right, like moderately, don't smoke, do the whole thing. So those types of things, like people are prone to, to unrealistic expectations. And then the final wish would be that if we do find something, that is a medical breakthrough that would be available to patients, to people all over the world very quickly. So, like if you have a vaccine that works or whatever, that, it wouldn't be just in the wealthy countries. It would be right across. So new technology will come out, but as well as I do, you can have access to care in a third world country if you wish, and that. But if they don't have the technology, you can have the best access. It's not there. So you want the breakthroughs to be disseminated throughout the world very quickly.
But there's more equality of healthcare across the globe. Those are fantastic wishes, and thank you very much for sharing them with me. I'm afraid that's all we have time for today. But thank you so much, Dr. Falcone, for joining me and also for your insights. I have learnt so much from you, as I'm sure our listeners have too. And I just want to say thank you so much for all the work that you have done for obstetrics, gynecology, and reproductive health. You've been involved in so many groundbreaking achievements, and I have so much gratitude for you.
Thank you very much.
And that concludes our 3-part series. Thank you for listening, and we'll see you in the next deep dive series.